COVID-19 is an infectious disease caused by a newly discovered coronavirus. It is also known as a novel coronavirus because it is a novel virus, which means it has never been seen or identified before by anyone.
This novel virus is responsible for this 2019 to 2020 pandemic, infecting thousands of people and taking thousands of lives from around the world. People are predominantly getting infected when others who have contracted the coronavirus cough or sneeze in the proximity around them, spreading the virus through droplets.
People who have contracted this novel virus may be sick for a time period ranging from 1 to 14 days before showing any symptoms, meaning they can still spread the virus even without showing any signs of being infected.
The main symptoms are fever, dry cough, tiredness, and shortness of breath. However, there have been reports of people experiencing diarrhea and nausea, as well as an unexplained loss of taste. In severe cases, you might experience difficulty breathing.
If you're experiencing extreme or severe chest pain to the point that walking and talking becomes hard, you should probably head to a hospital. Make sure to contact medical staff beforehand though.
How did all this start, you may ask? In December 2019, a cluster of people in Wuhan, China, began experiencing pneumonia-like symptoms. It started to spread across China like wildfire, and from then, it began spreading all around the world. In a short span of 3 months, over 1 million people had gone infected with the virus. At last, WHO, World Health Organization, finally declared this disease to be a global health emergency.
So, how do we prevent getting infected from the coronavirus? One of the main precautions that we must follow is to practice social distancing, of course, as well as regularly washing hands, wearing protective masks outside, avoid touching your eyes, nose, and mouth, drink lots of water, and by practicing respiratory hygiene.
If by any means you have caught the coronavirus, you should first isolate yourself at home. The isolation period can last up to 14 days and you need to stay away from others, including family members living in the same house as you. You should monitor your symptoms for at least 14 days, and if at any point you feel worse, contact your local hospital department for advice.
Truth is, from the hundreds of things you've seen on WhatsApp, you've probably been duped at least once or twice. Being out in the sunlight doesn't kill the coronavirus. Being able to hold your breath for 10 seconds doesn't mean you're not infected. Antibiotics do not kill the virus, and if you're convinced that only older adults and younger people are at risk, then you may be a little too gullible.
We're all in this together.
And don't forget to take vitamins to boost your immune system.